So, quinidine. Quinidine is principally used to treat. Quinidine is principally used to treat supraventricular tachyarrhythmias. Quinidine is classed as an antiarrhythmic drug. The type 1 blocks sodium channels. It reduces automaticity and responsiveness and increases refractoriness. It also has an anti-muscarinic action, preventing the bradycardia that follows vagal stimulation. Quinidine is used as a class 1 antiarrhythmic agent, that is, to prevent ventricular arrhythmias. Remember that it decreases the speed, the amount of the sodium going through sodium channels, and is concentration dependent. The more concentration there is, the more channels it will block. Quinidine is used to treat also atrial fibrillation. Its medical uses are, again, quinidine used as a class 1 antiarrhythmic agent that is used to prevent ventricular arrhythmias. It is also used to maintain sinus rhythm after cardioversion of atrial fibrillation and to treat short QT syndrome. So atrial fibrillation is its secondary use, but its first use is ventricular arrhythmias. Again, there's two questions here. Quinidine is principally used to treat supraventricular tachyarrhythmias. And second, quinidine is used to treat atrial fibrillation. Remember that there will be a decrease on the amount of sodium going into the cells because it decreases what the pharmacology of quinidine is. It acts as a blocker of voltage gated sodium channels. Inhibition of the sodium channel is specifically involved in its antiarrhythmic effect as a class 1 antiarrhythmic agent. It also will gate the voltage gated potassium channels and act as anti-muscarinic alpha 1 blocker. But the most important is that it reduces the sodium channel and is a class 1 antiarrhythmic agent. Just remember, class 1 antiarrhythmic agents interfere with sodium channel. Class 1 antiarrhythmic agents interfere with sodium channels. Class 1 antiarrhythmic agents interfere with sodium channels. Class 1 agents are grouped by what effect they have on the sodium channel and what effect they have on cardiac action potentials. The class 1 agents are called membrane stabilizing agents. The word stabilizing is used to describe the decrease of excitogenicity of the plasma membrane, which is brought about by these agents. Note that a few class 2 agents like propranolol also have a membrane stabilizing effect. So class 1 agents are divided into three groups: 1A, 1B, and 1C. And remember that all class 1s are um, drugs that have to do with the with interfere the sodium channels. So class 1 agents are divided into three groups, 1A, 1B, and 1C, based upon their effect on the length of action potential. So um, 1A lengthens the action potential or makes a right shift. 1B shortens the action potential, making a left shift. And 1C does not significantly affect the action potential, so there's no shift. So um, the class 2 are going to be beta blockers. They act catecholamines and B1 adrenergic receptors. So B1, remember B1 bone, B1 bone increases the heart rate and by um, letting calcium go in. Remember that there was a bone pounding on the heart and on the kidneys, a bone of B1, but also of calcium. So class 1 agents, class 2 agents, they act by blocking the effects of catecholamines at the beta 1 adrenergic receptors, thereby decreasing sympathetic activity of the heart, which reduces intracellular cyclic AMP levels and hence reduce the calcium influx. These agents are particularly useful in the treatment of supraventricular tachycardias, and they decrease the conduction through AV node. These agents are the lows. Agents on the two are the lows: atenolol, ismolol, propranolol, metoprolol. So remember, class 2, um, they'll they will be um, blocking the beta 2, beta 1 receptor, beta 1 receptor. So in class 2, remember there's two components, heart and kidney. So there's class 2, two components, heart and kidney, beta 1 receptors, and this class 2 will go to beta 1 receptors. And beta 1 receptors is spelled bone. And so bone has calcium. So calcium will be going into the um, cells, thus increasing the heart rate. Not increasing the heart rate. Okay. So the first one, the class 1, have to do with sodium channels, and sodium channels are decrease sodium um, influx to the cell. So class 1, membrane stabilizing agents. Class 2, remember, class 2, heart and kidneys, bone, calcium, beta 1 receptors. So bone, calcium going in the cells. There is a decreased sympathetic activity of the heart. So reduction of calcium. So calcium takes a beating, like the bone beating on the heart. So decreased calcium. So remember that class 1 agents interfere with sodium channels, and here we will have class 1, you will have three different types, 1A, 1B, and 1C. 1A will be, in 1A you will find quinidine, which is a fast channel blocker, and this blocks the sodium channel and potassium channel. The second one is the 1B, and it's lidocaine, phenytoin, etc. There's also a channel block, and it's fast.